name is Dr. Rick Seguil.
And action. Hey, Jay, this is Kirk again. And action. Hey, everyone, it's Dr. Rick. And I had a couple questions from Doug and Marizel and Michelle and Mark. And there's a lot of people that are coming off of COVID infection. So this is cool. COVID recovery is what I want to do. And I'll probably do a couple different videos. This will be COVID recovery video 1. If this is the first time you're finding me, though, don't forget to hit the subscribe button down below and please shelter. A thumbs up would be good. It helps the channel, but please shelter in place. And I'll show you why it makes a difference. More so than testing. I know that a lot of folks are wanting to be tested, but I just had a couple call up and I had to say, call the IDPH because I can't even get tested. I've been exposed twice already. Thank God I passed the 2-week mark. I might have antibodies. I'm hoping I have antibodies because I'm going into the shitstorm that's coming up in about a week to 10 days. And I feel like I have to do my part. My parents would have wanted me to do my part. I feel obligated. I know that I'm taking a chance, but I have good faith that I will be okay because of the healthy lifestyle that I've been running and doing and practicing along with my patients. So my patients are warriors. I want to be with them. I want to sign my own board, which I kind of have. But so this is my rant. I'm going to try to end this on a positive note, but we have to, again, figure out why should I stay sheltered? Because I know a lot of people are getting stir crazy. I got a lot of patients calling with anxiety and depression. Understandable. I got athletes that are calling with depression because they can't exercise like they used to. I have standard patients with baseline or quiet anxiety and depression now blossoming. And I have average patients without that are also coming in with or calling, because we don't see anybody in person anymore, calling with symptoms of anxiety and depression. And I can totally understand. My depression's coming out and my anxiety every time I watch new news is really blossoming and I can't take it anymore. So this is Hopkins database where they show the progression every day. Pretty cool website. So if you look at the cases in the world, we have now crested over 1,390,000 cases throughout the world. And the U.S., we're number 1. That's not the good way to be, but we're number 1. 378,000 that have been tested. And yet I can't even get a goddamn test, sorry. But I can't even get an antibody test. I think I'm resistant to it or have developed antibodies, but I can't even get antibody testing. I can't get my patients that I have recovered antibody testing. So sorry about that, my folks that are spiritual, but didn't mean to say that. However, this is the frustration I'm running into. I'm supposed to be a healer and guide people on what to do, and I base that on data. The data is lacking, and the information that's coming out is terrible. So anyway, so you can see all the red concentration here. This is New York, Florida, Louisiana is here somewhere, California, and Seattle. And you can see it's going to progress this way. Red will take over the entire country. It's just isolated here and concentrated. But if it took 3 weeks to get to this level, it's going to sweep over for another 3 to 6 weeks this way. I predicted that in Illinois we'd probably surge in the second week of April. And if you look at IHME, the nonprofit website, they actually break down by state the estimated, with their formulas, their estimated time of cresting. If you look at this, if assuming full social distancing maintains itself through May of 2020, this is the amount of, by April 16th will peak. That will be good so that's the forecasted. This is potentially where it could be. That's a tremendous decrease or a flattening of the curve. So April 16th, and then it starts to decrease. Unfortunately, the amount of deaths will peak at April 26th if everybody maintains full social distancing. And the amount of deaths by April 26th, unfortunately, for the state of Illinois is 3,524. I pray that none of you watching this will be part of that, but we'll probably know somebody. If you compare to New York, different story. They're supposed to crest April 8th this week. They're supposed to crest April 8th, which makes sense because if you look at the Hopkins model, it will sweep this way. So it's going to hit us next. We want to be flattening this curve, and that's where social isolation and distancing will help. So if New York hits the peak, and they're starting to show it already. I saw the plateau for the last 2 to 3 days has happened. But unfortunately, their total deaths, because even though the occurrences flatten, you'll still have deaths from the exposures. The deaths, 15,000. 15,000 by April 28th. That's not good. Total U.S. deaths looks like by May 21st. So that's assuming, I think it flattens out right here, 81,000. You guys can check that out on your own. What I wanted to do was put together a couple of options for you if you've recovered. And if you have recovered, I think we can speed things up. So my patients that have recovered, numbness and tingling, definitely fatigue, muscle wasting, and then the shortness of breath or cough. The cough is usually dry. There's one with anosmia, can't smell and can't taste. But I would treat this just like I do with chronic fatigue syndrome. Chronic fatigue syndrome could be considered a problem with the hypothalamus, sleep disorder, and difficulty with sleep, disordered sleep, disrupted REM, fatigue. Even fibromyalgia can be lumped into that category because a lot of my patients that are severe just can't get going. We don't have a playbook for it. So it doesn't follow the rules, doesn't have to follow the rules. And I bet you it's going to morph by this time next year and we'll go around again. Hopefully we'll have a vaccine at that point in time. The question will be, is the vaccine going to be deadlier than the disease? I don't know. And I came across something as far as the resemblance of high altitude sickness. So acute mountain sickness or high altitude sickness, when it gets to cerebral edema or pulmonary edema, almost resembles what's happening in New York. So in my previous video, when I went up to 14,000 feet, I felt shortness of breath, tachycardia, weakness, which I had to push myself forward through and hydrate the heck out of me. But about every 10 feet of elevation, and that's not just 10 feet of walking, that's about 20 to 50 feet of walking, 10 feet of elevation, I'd have to take a break because I was winded, my heart rate was going, my temperature was increasing. All these things turn around because the body is going into hypoxemia, no oxygen. And if you're short of breath and or manifesting severe acute respiratory distress syndrome, SARS, you have to be on a ventilator support. You have to be paralyzed so that the ventilator can take over. But sometimes if you just push pressure into the lungs, it'll keep the air sacs open, but the question will be, can you diffuse oxygen in that pressure of air through the tissues of the lung sacs into the bloodstream? And I think that's what happens with acute mountain sickness. I felt it, but in its worst case, acute mountain sickness ends up with hypoxia and disease and death if it's not resolved or if you don't descend. So sometimes acetazolamide, which is what this study was from, acetazolamide might help in the fact that it makes it easier for you to extract oxygen and not react so violently to the difficulty with getting oxygen in. Usually the getting oxygen in is the fast heart rate and the fast breath rate. This kind of negates that a bit if you're going up into altitude. So see my other video with regards to acute mountain sickness. This paper suggested 250 milligrams twice a day. Again, this video is not supposed to be a substitute for medical care, so you'll have to ask your own doctor, and plus this is a prescription medicine. Acetazolamide, 250 twice a day. And they also talked about nifedipine, which is calcium channel blocker, also help with oxygenation too. So if you can't get acetazolamide, ginkgo. ginkgo biloba. You might have varying degrees of different companies producing good product and different companies producing crappy products. So you have to go with a company that's reasonable, that you follow, that you trust. But check out my video on ginkgo that I've done in the past. I have used, this is the acetazolamide that I used from a long time ago. And because I'm a mountain guide, I have to have this just in case some of my patients don't respond too well. I mean, the most I've taken people to is 12,000. I've done 14,000. Most I've taken people to is 11 to 12,000. No, actually 11,500. I couldn't take them all the way up because we were not prepared for it. I was, but my hiking group wasn't. Ginkgo can be used too. Again, not as well monitored, but it's better than nothing. So you can either do ginkgo in liquid form, nasty, and or ginkgo in tablet form. I mean, pretty good. Nature's Way is pretty decent. So the only problem with there's essentially no problems with ginkgo unless you have. I think there's a couple of contraindications. One of them is if you're on a blood thinner, you have to be careful. The acetazolamide, though, this makes you pee. So I made the mistake of taking this at night because I came off on the mountain in the evening. I said, I want to avoid all the shortness of breath and I felt like I hit the wall, brain fog and total fatigue coming off the mountain a couple hours later. So I said I would try this, and I did, and I didn't. I got rid of my symptoms, but I couldn't sleep because I was peeing, excessively peeing. And it wasn't because I was drinking a lot. I was excessively peeing all night, like every half hour to 45 minutes. So, side effect. Again, so if you have a sulfa allergy, you can't use that. If you have certain medicines that you take and there are some contraindications, you can't take it. So you have to ask your pharmacist and your doctor. But again, if you can't do the acetazolamide because your doctor doesn't agree because it's off-label use, you can consider ginkgo. I also have this is a nice print up on the pathophysiology of acute mountain sickness or high-altitude sickness. So usually your doctors won't invest in treatment or understanding of acute mountain sickness because we hardly see it here on ground level, especially in Chicago. But I'm a first aid wilderness responder. A lot of the stuff will mirror the same stuff I'm suggesting for recovering from COVID. And we're going to have a lot of people recovering from COVID. So if you go back to Hopkins map, as far as US, we've got 20,000 people that have recovered already, and that's going to grow. It's supposed to hit 80% of the population, and 20% will have a bad outcome or go to the hospital. Put it that way. And a smaller percentage of that, I think 5% will have to go to the ICU, and a small percentage after that might not make it. But if 80% of the people do fine, you might have no symptoms at all, like with kids, or you might have symptoms of fatigue. Every system will be knocked off because you've just been ravaged by a virus, and your immune system was turned on to fight. In trying to get back to functioning with homeostasis, it might take a little bit of time. So resetting your circadian rhythm is really important. Sometimes we'll do, again, that's the best thing I can suggest for people with chronic fatigue syndrome or fibromyalgia is when you have a flare-up, push and crash it's called, you have to hunker down. And if you hunker down and if you've been training for the healthy lifestyle, hopefully your push crash episodes will be very, very short-lived and you'll be able to recover very quick. It's hard to say what to do with a novel virus because it's never been experienced before. Again, Corona was here back in 2003. That the true SARS COVID number 1. This is SARS-CoV number 2, so this is the second time around. Granted, the viruses, they come from the same family, but this one's presenting with much heavier virulence, transporting itself during times of asymptomatic carriage. That means you don't feel any symptoms. So those of you who are saying, I'm fine, I don't feel bad, hey, come on. As I mentioned, if you look at the data says if we maintain full social distancing, maybe we'll get by with only a couple thousand deaths. And if you're one of the deaths, then you would want to do as much as you can to maintain our chances. So please maintain this stuff until, and now we're going into not even going out for groceries. So I think it's important. Again, if those of us that are on the front line would appreciate, I'm not at the ER, but I'll be going there to volunteer because those guys are just getting burned out. The nurses, God bless them. The doctors, protect them, but they're getting burned out. They need help. So they need our help. I was apprehensive at first because I don't want to take the risk of death, but this is my calling. And for those of you who are not maintaining social distance, that is not fair. You are the last ones that we're going to, I hate to be that way, but you are the last ones that I would want to help, but I have to help everybody. So please maintain as best as you can. I'm pleading with you in Illinois and other states. It helps us as doctors, and it's going to help your family members. But if you make it through, but you have a whole bunch of crappy symptoms, my colleagues have nothing else to offer at this point in time. But I have a lot to offer because I've been taking care of chronic fatigue and fibromyalgia, but I can make suggestions for you. So subscribe to me down below. If you have anybody that's been recovered or suffering from it, please post this video or share this with them. Otherwise, God help us, but we'll make it through. It's just going to be a totally different landscape after we're done. So subscribe, and I'll see you in the next video.